This next session is actually sort of the bookend to the working groups. Seems like a week ago, but it was just the day before yesterday. Working groups came together at the beginning of this meeting and had some discussion about important ways that G2MC needs to be thinking and moving forward. And the sessions that I attended were really rich and a lot of good information, a lot of great communication and exchange. And in the next, 45 minutes or so, each of the heads of the working groups are going to report back what they've learned. And there should be some time for a little back and forth from the audience to refine even more some of our marching orders as we go forward. So we're going to juggle around a little bit the reports. So we're going to start with George and the membership working group. George.
Thanks so much, Alan. A couple of days ago, like Alan said, it seems like it was last week. Also, despite the fact that we have been discussing this issue about the membership, which is quite crucial for any scientific society, any organization like G2MC. So the main thing was to try to define what would be the criteria for entering someone in the organization as a member. And we all know that the G2MC started like almost 10 years ago. So we had this vision of who is, in fact, I would say who qualifies as a member. And in the past, we had this membership list was actually a number of people that have shown interest in the organization, interest in their activities, but they were in principle in and out. Okay, so we discussed yesterday, actually on Monday, what would be if it would be prudent to have tiers. So one of the suggestions was to arrange the membership basis according to 3 tiers. The first one would be the students. So those would be the junior members that have interest in genomics. So biomedical students, medical, biology, pharmacy, and the like, could be bioinformaticians as well. Then you have the full members that would at least have a master's degree and above. So PhD candidates, postdocs, junior faculty, senior faculty, and the like. And the honorary members. The honorary members could be, let's say, those that they have their term as chairman have expired. For example, Jeff. I wouldn't think of anyone better than becoming an honorary member like Jeff, who was forced basically to resign because of his engagement at the All of Us program in the US. Those that will be proposed by the former chairman to join because of their contributions to genomics worldwide. One example was Jim Watson, for example. And of course, since we're an organization that is dependent upon sponsorship, we could definitely have the industry members that will be, let's say, paying more to become members so that they could benefit from the organization. There, of course, as you see in the slide over here, we're talking about the benefits. So that's something that we should discuss, what the benefits would be. We're not the American Society of Human Genetics that could provide, for example, discounted fees to conferences, or it has, a huge membership basis. But we could come up with some benefits that the members of G2MC would enjoy. Such benefits, for example, would be some discounts for registration for conferences like G2MC conferences or conferences to which the G2MC would participate as a partner. For example, next year in Syros, we're going to have a summer school from a partner organization, which is the Golden Helix Foundation. So we discussed the possibility of offering a generous discount to members of G2MC that will be registered to attend this summer school. That's in September next year, and the G2MC will be a partner. Same thing would be for the Global Alliance meetings, that it's equally a partner organization to G2MC. Online courses that G2MC members could be willing to participate, and so on. And of course, something which is really, really important is the opportunity for members to get exchanges. So we have been discussing the possibility of offering short-term traineeships in the labs of senior members of the leadership. And I have personally volunteered to host one of such trainees from G2MC in our lab in Patras. It's not Harvard, as you know, but it's a lab that it has an international reputation because of their tangible contribution in the field of personalized medicine. And we have also discussed the possibility of having, again, two tiers for those traineeships. Ones that could be supported by the trainee himself or by his or her organization, and those that will be supported by the G2MC itself. And for that, we'll set some clear guidelines for the person who will be eligible to apply. So those will be announced in the very near future, right, Eji? Yeah. Okay, so the ultimate goal would be to grow the organization such that we'll have at least one member from 100 countries. And that would be the overarching goal. 2025 is literally around the corner. We already have a membership basis constituting of members from around 40 countries, I think. So I believe we can make it. We'll try along these lines. The leadership of the organization and all of you are, encouraged to all of us to work together so that we can ensure that the organization grows as we would like. So if you're not a member of G2MC, please join through this QR code that you can see on the right-hand side. Talk to your colleagues, try to explain to them what G2MC is about. And and above all, try to make tangible engagement. I like this word, tangible, because if we're just talking, I'm interested, okay, I'm interested in something, but you have to show you're interested, right? I'm interested to collaborate, okay. It's not a part of discussing this over pretzel and beer, okay? Just make it happen. The same goes for any collaborations. And it's important that the members could contribute, and that would be, I think, one of the fundamental issues for of the requirements for someone to apply for a traineeship. Ludi, do I miss something? I think I got everything that we discussed. So are there any questions before I give the floor to the next working group, Chair? Teji, please. Yeah, as I said, so the other thing that I skipped is that honorary members could serve as advisors and ambassadors. So that's what we are actually doing. Speaking of myself, whenever I go abroad to give a talk, I identify myself as the G2MC chair. So, people ask me what this is about, so I can tell them, for example. I guess that can be also done by executive committee members or steering committee members, right? So yeah, I think it's quite imperative that we identify G2MC as a organization that is engaged in the implementation of genomic medicine. Yeah. Okay, so that's basically the outcome of our discussion. Thanks, Farah, for putting it together. Yes, please. Yep. Okay.
Industry members being treated any differently than academic members. I mean, I realize that the G2MC needs to raise funds, et cetera, but I think, most people in industry, that are interested in G2MC, they're scientists and they want to be equally engaged with academics and considered sort of equals as opposed to different.
So I guess that I agree with you, Alan. I guess that whatever if such so the base of such decision would be that industry purchases on behalf of the academics seats, and if we go one slide back, please, then you'll probably see that it's written.
Okay, so you may want to call that sponsorships or something like that.
Yeah, so the sponsor number of seats. Okay. Yeah. And the other thing would be, of course, attending conferences as a sponsor. So I think that would be something as inclusive of what is being paid. Of course, now we have the gold, silver, and other sponsor status. But I presume that's something that will be included in the contribution from the industry, as you can say. After all, there's only one conference every 18 months. So, considering the fact that the annual contribution, then that goes perhaps once per year. Yeah.
Anything else from the group?
That's perhaps for the afternoon, right?
All right, let's move on to the next. And again, I've juggled a little bit the order. Vajira is going to talk about the implementation working group and report back what he's learned.
Okay, so I'm going to talk about the implementation group. So having looked at the membership, we want to bring value to the membership through our implementation projects. So that's has been the focus of G2MC. So next slide, please. So next slide. So the objectives of this breakout, or before that, I'd like to tell you that we started the implementation group recently following the discussions that we had with the new strategic plan. So this is a new group trying to be, give overarching guidance to implementation projects. So therefore, we wanted to have this breakout in a way, first of all, where we wanted to listen to the membership as to how we could help. Then refine the mission statement, goals, activities of the working group. And then also we wanted to collaborate with the Resource Center working group because we want to collaboratively bring value to the membership. We had a long discussion, and in that discussion, there's a slide before this. Okay, there were themes that emerged. They were, first of all, in these implementations, our membership wanted us to go beyond and look at other things that impact. genomic medicine implementation, quality of life, healthcare decision making, diagnostic and therapeutic trajectories, cost consequences to the healthcare systems, and so on. And then consciously address issues of ethics, diversity and inclusion, equity, equality in healthcare, and also how you leverage other technologies, digital, artificial, and intelligence, and so on. And they also wanted us not to lose focus on local capacity building and utilization of local resources so that we will bring value to everywhere. And then, of course, we also realized that there was a need to cater to early career investigators' needs to enhance their projects, not the big implementation projects that we talk of. There may be an investigator out there looking at a little bit of funding, maybe $1,000, $2,000, which will make a big difference to the project that they are conducting, and so on. So having deliberated on all of these, we went back to refine our mission statement, where we had a few suggestions. So what's underlined is what we've added on, and we can have further discussions on that also. We wanted to develop an approach and set the standards for what a G2MC flagship project is through the development of common templates, guidelines, and application and review processes for relevance to G2MC, and a monitoring plan to ensure outcomes and distribution of results to the genomic medicine community, and going beyond that to policymakers at local, national, regional, and global level, because as you know, one of the reasons why we are here today, we met in Geneva today, is to see how we could align ourselves with the work of the WHO and how we can bring value to them as well in our work. Then the second objective goal was to oversee the implementation of G2MC flagship projects, solidify its applications, provide access to expertise to address the thematic areas identified in the breakout, and then select projects, find funding, set implementation targets, monitor and evaluate progress. So as you can see, there is a lot there. So having listened to all these thematic areas, we realized that we need to work on all of those things that were in the previous slide. And then finally, what are our next steps? So we will go back to the working group and have further discussions on this, what we identified. We'll also discuss with the Resource Center Working Group to identify what additional resources we require, because as you can see, those thematic areas would require us to tap into expertise that we have not worked with before, and that is also something that we have to do with the Resource Center Group as well as others. And then finally, refine the process further and make announcements for expressions of interest for new flagship projects, probably in the first quarter of 2024, so that we gather momentum from where we've build on the momentum that we have gained in this conference here. So that's the presentation from our working group. I'll be happy to take any questions.
Question?
So Vajira, I was aware that when you had that breakout session, you had asked for a couple of people to submit a description of a project they wanted to do. And I assume that those were shared during your breakout session.
Yeah.
I was just curious, as you saw the descriptions of their projects,
Yeah.
did you see what the implementation work group, could you see how that implementation work group could help those people with their projects?
Yes, so those thematic areas that I presented were the ones which were emerging from that, right, from those projects. And so we need to look at, so they, alluded to us that we should be looking at this broader picture, and therefore now also look at what resources, for example, if you're looking at the social aspects of implementation, who are the social scientists we could collaborate with. If you are looking at the economic impact, who are the health economists that we can work with, and so on. So I think that also talks to the broader issues that come up in implementation project, and because we are focused beyond just the research, implementation, and ensuring translation of what we do to health systems and long-term sustainability. We'll need to look at all of these, and so that is why I think our remit has got really broadened because of that, and that is it's a challenge plus an opportunity, and also tells us what we need to be doing. So I think so I must thank the two projects that the two projects that were presented, Gabriela as well as MK, and then the young investigator who came and said, okay, this is you are looking at this big picture, but what about us? These are some of the little things that we would need your help with. So yeah, that's George.
So one of the main reasons why the pharmacogenomics working group has been set in a dormant mode is that because we have announced the project, as you remember, and many people showed interest, but this was not followed by actions. So you remember, Grant? Yeah. So it may seem, for example, that if it wasn't for you and Alan to push this flagship project forward and so successfully, it wouldn't have ever taken place. And but it's a wet lab project, and I start thinking whether it would be prudent to consider projects that relate more to public health. Economics are such project, of course. They're very much needed because we're talking about clinical implementation of pharmacogenomics. One needs to provide evidence for clinical and economic evidence to be able to get them reimbursed. Ethics, it's something very important.
Yeah.
I've seen outside posters related to raising genomics awareness. That's equally important because this is not the case particularly for developing countries. So those could be projects that we may consider embracing, encouraging, and which I think will have a very big impact on how we, let's say, coupling this to the wet lab results.
Absolutely.
As a suggestion.
Yeah, totally agree with you, George, because I think in the context of global health, we need to do exactly what you were suggesting, looking at the economics and other aspects. So definitely. So it's not just the wet lab projects. Especially I think at the PI institutional lead level, we can be talking about things like economic impact, how strengthening health systems, and so on. All the other topics that come up with human resources for implementation of genomic medicine, and so on. So there's so many things that we could look at.
Yeah, I guess some of the G2MC members will recall that in an earlier rendition of working groups, we had a policy
Yeah.
working group. I guess with that being disbanded, we need to think about the implementation group taking on a wider role in terms of these other issues beyond the science.
Absolutely.
I guess one thing that, as co-lead in this group, struggle with is, what is the motivation of our members to come forward to propose various implementation projects in the absence of G2MC being able to provide funding for those implementation projects. And I think the answer is that at some point we do want to be able to provide funding for those projects. But as part of our membership, we have funding agencies that are always in the audience and can potentially attract interest in funding some of these projects. And at the very least, coming forward, with proposals for implementation projects, we can provide essentially a coordinating role, a matchmaker role in some ways, where maybe someone in the audience has funding, to do something similar in their country, and they want to go international with their idea. Potentially then the opportunities to write supplements to grants or other opportunities to get funding for expansion. So
yeah, thinking
I'm
aloud,
excited about those
there's
possibilities.
a hand up at the back, but
Sure.
as you go there, one of the things that crossed my mind, listening to the conversation that went there in our breakout was that, maybe if we have a little pot of money, which can supplement, young PhDs, young MSCs who are working in LMICs, where we could give really small grants, but that could make a difference. Like, it could even be $2,000-3,000, dollars, but that could make a huge difference in that setting to make sure that those, projects go to a higher level. Because I examine, I can tell you, various PhD theses and others that come to me from the South Asian region. And when I see them, I just see a little bit of money could have really enhanced and taken it forward. You don't need the millions, you just need, 2,000-3,000, and that can really make a difference. So, this little pot that we create, which we can, if we can do that, maybe can do a world of difference to young investigators in LMICs. So that I wanted to, that's something that I wanted to take forward as a discussion in our group later. Yeah, Calvin.
So picking up on that, so I think strengthening our engagement at G2MC with low and middle income countries, I think would be wonderful, and maybe having a working group on that. But I was also thinking specifically about grants. What if some of us could actually provide advice and hopefully helpful critiques on grants that people are writing? Some of us have written a grant or two, and even gotten some. But for some people, especially in LMICs, it might be very helpful if you could have some advice on your grants, and hopefully also helpful critique.
Thank you, Jan. Yes, absolutely. So, grant writing support was one of the things that we want to have in that list when people make expressions of interest for a project, supporting with their next step on getting a good grant written up and submitted. So grant support is also an aspect that we are looking at.
Anything else from the group? Okay, let's move
All
on.
right, thank you.
Thanks, Vajira. And we'll hear next from the Resource Center, both a relatively new entity, Grant and Michelle.
Thanks for that. We're coordinating. We didn't quite mean to do that today, but so we are a very, very, very new working group. We met for the first, well, Grant and I met for the first time last week, and we also met as a group on Monday for the first time as well. So what we're going to tell you about today is what our initial discussions are and where we hope to go in the future. So these are the people who are involved. So obviously Grant and myself and Satiris as well. So what we're hoping to do, and I've got an aim in progress there because we're still exploring what this means, is to look to have a repository for all of the G2MC working group outputs. It would be a place where the implementation project guidelines, templates and everything could be held there as well. And information also maybe about the G2MC members as well. So looking at the membership database, having a place where people can, you know, actually look to see who is in the members and maybe make links with people that would be helpful to the work that you're doing. But also want to look at whether we can store links, not necessarily host, resources that would be of value to the G2MC membership as well. So, but there is a longer term vision, and the idea that would be that this resource centre would potentially grow to become the resource centre for the GGMC. And with this, thinking about, and perhaps this also aligns with the work that's happening with the membership group as well, is thinking about tiered access to this resource group. So the idea that will be some that would be publicly accessible so that people can understand what the work is of the G2MC and have some maybe executive summaries of the projects that are happening, but actually the bulk of it is available for G2MC members, and that's a benefit that would come with G2MC membership. But it also would be a platform that can host a variety of artifacts and assets. So we're really thinking future-proofing this, so not just building it to hold assets that are available now, but thinking about what might be in the future. I don't know if you want to talk about the family health history artifacts. This is very much your area.
Okay, I'll just go over this list fairly quickly. We decided, since the Family Health History group had already started on many of these activities that would go into, that eventually would produce some sort of an output or artifact that would go into the resource center, that we would kind of focus on these efforts first. But certainly this is not exclusive. We certainly want to as we're working on these family health history items, that we want to be open to any other items that the organization is developing or working on for the resource center. But this is as some examples for you to give you an idea of what might be in a resource center. So within the Family Health History group, one of the activities we're doing is creating a repository of risk assessment algorithms. Within a Family Health History application, there is an algorithm. This is an application that you want to have these algorithms in, okay? So this is an advanced family health history app. But this is where you look at the pedigree and you see, okay, I've got a second-degree relative that, you know, died of a heart attack. So what does that mean for my risk? Well, I might be at a moderate level. That's what the algorithm says. Or I've got two first-degree relatives with a specific cancer. So now I'm at a high level of risk for developing that cancer myself. These are very simple examples, but this is what an algorithm does. And they're in these applications, these family history applications, these algorithms exist. These algorithms have been developed by usually some research organizations or medical specialty organizations have developed these, but there is no single repository that houses all of these algorithms in one place that is searchable and usable. And so this is one of the projects that we're embarking on right now and will eventually be part of the resource center. And so you can see some of the other examples here too, of some of the things that we're working on. And like I say, these will be into the resource center. And I wanted to share these with you, so as your other working groups that you're working on are developing outputs or some artifacts, please keep in mind that at some point we'd like to put those in the resource center.
So the initial discussions that we had on Monday is really focusing on what our next steps are, and really that is about what we need to find out. So the first thing is we need to know what would be useful for a resource centre to have for the G2MC projects. So we'll be reaching out to all the people who are involved in working groups to find out what would be useful for your group's perspective for a resource centre. But we also need to know how G2MC members would like to use the resource centre as well. So we'll be looking to have a survey around that as well, just to capture your views. We know we need to capture ideas for a range of artefacts and assets. We've got a list already, but we need to make sure that this is not, we're not being restrictive on what we're doing. So we really want to be aspirational about what we can include. We also need to ensure we're not duplicating effort. There are a number of great resources that are out there already. We've heard about some of them to do with education and training. We just need to ensure that what we do works for the membership, but it's also not duplicating what's already out there. And importantly, we need to define what's going to be included and what will not be included as well. So it's very clear what the remit of the centre is, the resource centre is. We also need to consider all the operational requirements. So how will the artefacts or assets be submitted? How are we going to authorise that it's the right person that's submitting them? How can we validate the usability, the quality of this? How are we going to put in place processes to make sure that the maintenance is there? We all know that we've been on websites or repositories before where links don't work anymore. So we need to make sure we build that in. And this list is not exhaustive. And then finally, we also need to consider the technical requirements. So this is very new, so a decision has not been made about whether we buy or we build yet. Either way, a process is going to be involved for each, and it's quite likely that it could be a combination of both. We need to make sure that through this process, we capture all the application requirements as well, so that it can support various content types. And importantly, design the user interface. We want this to be a really attractive site so that people want to use it, but it also needs to be very intuitive to navigate as well, so that you can find what you need, which is the whole purpose of the resource centre. So we're going to start with monthly calls with the working group. We are a small group at the moment, so please do let us know if you want to be part of that. And what was talked about before with the membership, please indicate whether you would like to be part of the working group through those channels. We'll be reaching out to all the other project code leads. We'll do a survey with G2MC members as well. And Grant will also be working with the pilot project around the family health history artefacts. So I suppose it's to watch this space, and we'll keep you updated about how things are progressing.
Great, thanks. Comments from the audience? One suggestion in terms of maybe jumpstarting the resource center. During all of the presentations, everyone holds up their iPhone and takes pictures of their PowerPoint presentation. It would be great if the speakers could provide their PowerPoint presentations, at least the overview slides, if they're comfortable sharing, because we all like to kind of use or adapt slides, and I think that would be a terrific resource to start off with. So maybe we can ask the speakers to share slides, at least the ones they're comfortable with sharing. Anything else? Okay, thanks. All right, I think I'm next on rare diseases.
All right. So Vajira and I lead the Rare Genetic Disorders Flagship Project Working Group. And the goal is simply stated for this working group is to facilitate implementation of genomic medicine, largely whole exome sequencing and other emerging technologies for the molecular diagnosis of patients with rare undiagnosed genetic diseases in diverse LMIC settings. And this may be the oldest of the working groups, so I think we've maybe made more progress than others. it's great to see that the group still is really very passionate about this project, and for that reason, really, that's the reason it has moved forward to the extent that it has. So the objectives of the breakout that we had, again, just the day before yesterday, was to share results of the current progress of the G2MC pilot rare undiagnosed disease flagship project. That provided an opportunity for each of the clinical sites to actually provide their perspectives on how the flagship project went, and ultimately lessons learned that we hope to share and bring forward. And then obtain feedback, of course, from the wider group on the pilot project, and ultimately then to see how we can move forward to discuss models for scale up. So the themes that emerged are shown on this slide, and I should say that there's heavy overlap between the implementation working group and this rare disease flagship working group. So everything that Vajira showed on the implementation side of things applied to this, and we learned a lot in that group that transcended into the rare disease working group. So the themes that emerged here was that, the pilot study, as we presented, 6 sites, 18 trios, work that I presented yesterday, was in general, well received. It identified a number of challenges and that were common across sites, as well as challenges that were specific to each individual site. And that was with regards especially capacity building needs that differed in some cases were common across sites. There's continued interest to work together to scale up. And I think it's clear that there are going to be exponential increases in logistics as we scale up. But there's interest and passion to do this, and I think where there's a will, there's a way, and we will find a way to scale up. The model for scale up, we discussed a bit, and again, it doesn't seem like one size is going to fit all. We're going to have flexible models that work across countries and across sites. We talked about a research model in which there would potentially be a centralized IRB, centralized sequencing, still trying to maintain some level of autonomy of the clinical sites to essentially use and optimize their own workflows and use resources that we hope will become available for this scale-up project in ways that benefit their individual sites. We also talked about a clinical model in terms of building local capacity, sequencing locally, and the like. And I think this may work better for some sites in some countries than the research model. And of course, these two models are not mutually exclusive of one another. And we're hoping that we may be able to integrate some of these ideas into maybe a hybrid model that could be generalizable across 20 plus sites that expressed interest in the scale up. Independent of the scale up, this group, again, with the passion to expand diagnosis of for patients with rare undiagnosed diseases, continue to work closely together, with other groups and organizations working in this space. You heard several talks around rare undiagnosed diseases and a lot of things that are going on independently of this working group, but for which I think the working group has, greased the gears a little bit in terms of helping accelerate some of this work. And there's a real willingness for LMIC clinical genetics programs that have strength and expertise in some areas to share their strength and expertise with other LMIC sites that might be less advanced. And there was also discussion around additional implementation projects that could either be piggybacked on top of rare undiagnosed diseases or independent projects. Fair bit of discussion around epilepsy as maybe one area to carve out and build and grow within rare undiagnosed diseases. You heard from George about pharmacogenetics. Cancer genomic medicine also came up. And We also heard suggestions about how really rich the educational component of the pilot program was, and we're going to look into ways of opening up participation in those educational programs to a wider audience. And this is with reference specifically to the case conferences that were initiated. So in terms of next steps, of course, we'll continue our meetings virtually to talk about these topics and ultimately share these additional challenges and lessons and help others to find solutions, and continue discussions about the scale up, the model, and individual site needs. And ultimately as well identifying funding partners that will enable the scale up. So that's what I have. Any of the working group members, Vajira, others, please add. Silence. All right, great. We have one other working group that will report back, and maybe this has already been done, the family health history, or is there more to say, Grant and Theodora? More, please come on up.
Good morning, all. So we do have more to say, and we don't have slides to share. But we thought that it's going to be an idea to trigger your interest and update you on what we have been doing. And if interested, please come along, join us. We have our monthly calls during the last Thursday of each month. And of course, our emails, and Grant and myself will be more than happy to have a live discussion on the matters and the topics that we're going to present you right now. So we have been discussing a lot, not only on Monday, but also with our membership. And Grant has put together a series of slides that we have shared with our members, also echoing their voice for the people that they could not attend the meeting in Geneva. So long story short, we will work together with the implementation working group and the resource center, as Michelle and Grant already described to you earlier, regarding the tools and how these tools can be as widely applicable as this can be. We truly believe, and we keep on working, that family health history is a cheap yet very reliable tool that can be of wide use worldwide as a risk assessment tool, and also being informative in many, many projects in rare diseases and common diseases in countries with resources and countries with better and greater needs. So that said, we have been strategizing our aims and objectives. We are working and aiming on having tools available. We are standing by to those that they have tools and they would like to apply or update them further. We are standing by those that they don't have the means and they are using paper-based family health history methods to assist on the information and the questions and the needs that they have to address. And on that behalf, now that we're more mature or more excited or even a little bit more crazy, we are going to go and pursue a worldwide goal on hemoglobinopathies. This disease phenotype has been put forward by us as colleagues, but it was also very much supported by our members. So this is step one from the 10 steps in total. It comes along regarding education, regarding dissemination, but also the very first step will be a survey from our members, from our national champions, as we call them, to actually map their needs. And then as a group, we are going to support those needs. We have done that in the past. You have enjoyed during session one, Protisas Warwaris and Saint Kinosa's talk regarding the wonderful work that has been done in Nepal. We still have ongoing projects like that. And on that behalf, we will start with hemoglobinopathies. It's a wide area of huge interest around the globe. We will use family health history as the first tool to address such needs, see in terms of education, in terms of awareness, where medical colleagues and health professionals stand. We will address in the best way we can, together with our national champions, cultural differences and limitations. We do work, and this is where we put emphasis on data and sensitive items that we need to know and we need to consider. And from step one, so from that survey and onwards, we have we have actually collected great interest from Singapore, Malaysia, Sri Lanka, not to exclude some of, but many, well, Greece, but many LMIC countries where we want actually to put forward our strengths and limit their weaknesses. And on that behalf, I think I should not forget that it will be at the end of this step-wise process. We aim actually to achieve all 10 steps, but of course we're gonna go back. We're gonna question ourselves if we're still of relevance, if all those steps really matter to all of us, and because this is actually what Grant and myself keep on doing, like questioning ourselves, asking the membership, and trying to check out the boxes. That's pretty much what we have in mind, I think. I'm pretty sure. So any questions later on? Thank you.
I'll make a comment
Yes,
too.
please.
I just wanted to share this with you. So the work that we're doing in the Family Health History work group includes everything, obviously, that Theodora shared, but I wanted to share quickly kind of like what's the end game, what's the big picture, what's the big vision of us doing this work. And I've been involved in trying to advance the use of family health history in healthcare for many years, I think 18 years so far. And we've always had this goal from the beginning that we have not achieved yet anywhere, not even in the US. And that is building a ecosystem of family health history applications that exist out there. So there's more than just one to choose from. And you choose from these applications, adoption of electronic computer-based applications that capture this information, helps create a full pedigree, puts in the full phenotypic data on there for each family member, run some sort of a risk analysis for the proband of that family history, have these apps used by not only the doctors, the clinicians, but also the patients at home, doing this with their family members. So that's really the bigger picture that we want to get to. And it's a pretty big effort to get there. And so that's why we decided we would break down that big goal into these 10 steps and take them small pieces at a time. But we want, as we do these small steps, we want everybody to understand what is the bigger picture that we want to get to. And that's what we want to get to. So with that, any questions about what Theodora said?
We heard about surveys, I guess, in 2 working groups. So will our members be expecting 2 surveys, or are you going to try to combine them into one? So the survey, the resource group is going to send out a survey, is that right? And family history as well?
Yeah, they're different ones. In fact, I think our early surveys, we had talked about we would survey the family health history members first, because actually we aren't surveying them. They are doing the survey themselves to their colleagues in their countries to establish what the current needs are around family history, what the current capabilities are, what needs to be created. We want them to know what's happening in their location, in their country, and get a baseline of what's happening or what's not happening, but what needs to happen. And with that information, then that person who's the champion in their country for family history can build out kind of a plan, a project to implement something in their country.
Can open up just the last minute or so for discussion of any of the working groups if questions cropped up from prior report outs. Anything? All right, well, I think it's pretty much exactly noon, which puts us on time, right, for lunch. Thank the audience for their input, and thanks to the speakers.